I am Dr. Rajesh Malhotra. I am Chief of JPN Apex Trauma Center and Professor and Head of the Department of Orthopedics at the All India Institute of Medical Sciences, New Delhi.
I am Dr. Amit Latwal, Additional MS Trauma Center AIMS.
Hi, I am Dr. Kamran Farooq. I am Professor Orthopedics.
I am Dr. Vijay Sharma. I am Professor Orthopedics in All India Institute of Medical Sciences.
I am Dr. Babita Gupta, Professor, Department of Anesthesiology, Pain Medicine and Critical Care.
I am Dr. Atin, Professor of Radiology.
Hello, I am Dr. Kapil Dev Soni and I am Associate Professor of Critical Care at AIMS Trauma Center.
I am Dr. Surya Kumar Dubey. I am working as an Assistant Professor in the Department of Neuroanesthesiology and Critical Care.
Hello everybody, I am Dr. Madhur.
I am Dr. Rajiv, Duty Officer from the Department of Hospital Administration.
I am a trauma surgeon.
I am Dr. Amulya, a trauma surgeon.
I am Nidhi Sharma, physiotherapist.
I am Kapil Shishu, Head of the CSSD.
I am Surinder Sharma, Swasthya Adhikari, JPNATC.
I am joined by my team at the Trauma Center, including my faculty, my residents, nurses, including the hospital infection control nurses, and the entire staff in our commitment to prevent sepsis and to emphasize and educate the people about the importance of hand hygiene for preventing sepsis. The World Health Organization's Save Lives, Clean Your Hands campaign aims to emphasize the importance of hand hygiene in healthcare and brings people together in support of the hand hygiene improvement. Sepsis arises when an infection alters the body's normal response, causing injury to tissue and organs. Every year, sepsis affects 30 million people, 3 million newborns, and 1.2 million children worldwide. Anyone with an infection can develop sepsis, but some are at more risk than others, such as pregnant women, newborns, old people, immunosuppressed people, people with chronic diseases and hospitalized patients. Hand hygiene is relevant to all health workers, patients and their families at every single healthcare encounter, and also strongly supports the water, sanitation, hygiene and health WASH and global antimicrobial resistance, also called as AMR agendas.
One of the main mechanisms of transmission of these microbes to patients is through hands of healthcare workers. They are transmitted from one patient to another, or from objects and equipments to patients, or from healthcare worker to patients through the hands of healthcare workers.
It's my pleasure to give this message for infection control. Especially in orthopedic patients, infection has a very important role because orthopedic surgeries, they involve a lot of implant usage, and once we have infection in implants and in bones, it's very difficult to control infection, especially with relation to orthopedic patients. So I would say that we must all as healthcare workers practice as well as teach, promulgate hand hygiene in this class of patients.
I request all healthcare personnel, doctors, staff and all the even patients and patients attendants, those who come in touch with the patient, to follow strict hand hygiene, wash their hands or scrub their hands before and after touching the patient so that life-threatening sepsis is prevented.
A negative indicator for any hospital for its performance, and therefore it should be viewed as a quality indicator.
Although we take many precautions, hospital-acquired infection always remains a risk in any hospital environment. Following the guidelines strictly to prevent these infections is everyone's responsibility.
I want to give this message that the chain of survival of sepsis begins with prevention, and the prevention begins with hand hygiene. So let's together breach this chain.
So I welcome you on this Global Hand Hygiene Day and reiterate ourselves to having a more clean and more germ-free environment.
Hand hygiene can save millions of lives which are lost due to sepsis and other hospital-acquired infections. Every time we touch a surface in a hospital, we carry these highly resistant bugs in our hands. It is these bugs which we carry home in our families and communities and thereby spread these resistant infections in the world. So please practice hand hygiene and survive sepsis.
The Jayaprakash Narayan Apex Trauma Center received the prestigious WHO's Asia Pacific Hand Hygiene Excellence Award for 2015. This was the first time that a public sector Indian hospital received this prestigious award.
Prevent sepsis, it is in your hands. Maintain this in healthcare too.
So they are associated with ventilator-associated pneumonias, they are frequently associated with urinary tract infections or central line infections. The major mechanism to check these spread of these organisms is by use of hand hygiene.
Now this has been found to be very effective in decreasing the transmission of hospital-acquired infections, and in this way you can save lives. So the message is clear: clean hands save lives. Hand hygiene has been proven as the most cost-effective method of preventing healthcare-associated infections.
Sepsis is one of the leading causes of morbidity and mortality among hospitalized patients. The use of advanced antibiotics for the treatment and prevention of sepsis not only puts a lot of financial burden on a developing economy like ours, but also leads to antimicrobial resistance. The resources utilized in the prevention of sepsis and infection can be very well utilized in the treatment of other deserving patients, especially in a resource-limited country like ours.
We are observing 5th of May as Hand Hygiene Day at Trauma Center AIMS.
And you know, like WHO had mentioned, 5 moments of hand hygiene before touching a patient, before any aseptic or clean procedure, and after touching a patient.
So actually it is very important for us to practice hand hygiene so as to prevent infection and cross-contaminations.
Our lab technicians are well trained in hand hygiene before and after handling the samples.
I encourage all my nurses wherever they are posted to follow and comply with WHO 5 moments of hand hygiene.
हम लोगों को लैब में बहुत सारे इन्फेक्शियस सैंपल हैंडल करने होते हैं, इसलिए स्पेशली हम लोगों को बहुत ध्यान रखना पड़ता है हैंड हाइजीन का।
इस हैंड हाइजीन डे पे मैं प्रण लेती हूँ कि मैं हमेशा हैंड हाइजीन करूँगी। JPNATC, I ensure that the supply of alcohol-based hand rub and hand washing solutions are adequate in all the clinical areas. I encourage the nurses to be a role model in practicing hand hygiene.
I am committed to monitoring hygiene practices to improve compliance. I strongly support hospital infection control activities.
I would like to pledge to make every effort to raise bar of hand hygiene compliance in my ward.
जो मरीजों की सेवा में अहम भूमिका निभाते हैं वो हमेशा ध्यान रखें कि हाथों की स्वच्छता बहुत जरूरी है.
On the occasion of WHO Hand Hygiene Day, I take an oath that I always maintain healthy and hygienic hand practices.
We are more careful about the dress and linen and packing of the material with quality control management system.
मैं पेशेंट को छूने से पहले और पेशेंट को छूने के बाद हैंड हाइजीन करता हूँ.
In physiotherapy, we follow the WHO 5 moments of hand hygiene to prevent cross infection, and I pledge to do hand hygiene.